Ang susunod na programa ay rated PG. Ito ay nangangailangan ng patnubay at gabay ng magulang para sa mga batang manonood.
Ang pinakamataas sa bilang sa nakalipas na isang linggo. Sa mga kasong naitala kahapon, 32% o 319 cases ang naitala sa Metro Manila. 31 cases mula sa iba't ibang rehiyon at 135% ang naitala sa Central Visayas.
Para po sa inyong mga katanungan at concerns tungkol sa inyo lang 02-894-26843. Para naman po sa PLDT Smart Sunday subscribe, dahil po patuloy po kayong makibalita sa mga pinagkakatiwalaang sources na impormasyon tungkol sa COVID-19. Maaari nyo pong bisitahin ang covid19.gov.ph at pinapaalala po natin muli na manatili sa ating mga
Sa isang pahayag po ay muli ipinaliwanag ni Senator Bongo ang kaibahan ng hatid tulong program sa Balik Probinsya Bagong Pag-asa o BP2 program ng pamahalaan. Anya, ang BP2 ay para sa mga naninirahan sa Metro Manila na nagnanais na magbalik sa kani-kanilang mga probinsya. Layo nito na i-decongest ang Kamaynilaan sa kani-kanilang mga probinsya. Layo nito na i-decongest ang Kamaynilaan habang sinusuportahan ang paglagon, habang ang hatid tulong naman po ay naglalayong matulungang makauwi sa kani-kanilang mga pamilya ang mga locally stranded individuals sa iba't ibang bahagi ng bansa. Sa kasalukuyan ay pansamantala munang ipinagpaliban ng BP2 para bigyan ang paghahatid sa mga LSI sa kani-kanilang mga probinsya. Anya, ibabalik lang ang naturang programa sa oras na maging handa na ang mga local government units na tanggapin ang mga magiging benepisyaryo nito. Nagpaalala pa rin ang senador na mahalagang mahigpit na ipatupad ang health and safety protocols sa pagpapauwi sa mga LSI at hinimok ang IATF na imbestigahan ang mga unauthorized travel. Lalim ng pangalan ng programa.
Samantala, Senador Bongo nagpaalala sa mga posibleng sakit na dala ng tag-ulan sa pagsisimula ng panahon ng tag-ulan.
Sa ating mga panauhin ay maaari po kayo magkomento sa aming live feed at sisikapin po namin bigyan ito ng kasagutan.
Una nating makasama sa ating public briefing mula po sa World Health Organization, Rabi Abeye. Welcome po sa programa. Good morning to you, Dr. Rabi.
Good morning, magandang umaga po.
It's good to see you once again, sir. As of this moment, the Philippines has a total of 36,438 COVID cases, in which 24,525 are active cases. Based on the data and other researchers conducted by the World Health Organization, what is your initial assessment on how the Philippines is dealing with this pandemic?
Thank you, Martin. It's good to be back again. The Philippines has been doing relatively well in comparison to many of the worst affected countries. We are happy that the Philippines went into a very early lockdown, which actually helped prevent possibly hundreds of thousands of cases and thousands of deaths. What we are seeing now is that with the gradual relaxation of the lockdowns, we are seeing increasing numbers of cases. But we need to be careful here because the Philippine government has used the lockdown to expand its capacity for testing of cases and for expanding capacity in hospitals, isolation and quarantine. Patients. And this has paid off. And so we are now seeing is increased numbers of cases being reported because of increased testing capacity. What is actually, and this is not actually a bad thing because you're actually detecting the transmission that is out there. What is a little bit concerning is that we are seeing areas or localities where there is evidence of increasing transmission rates, where the test positivity rate is going much higher than the national average. And this is worrying. You are aware that we are seeing such places within NCR and in Cebu City, and also emerging hotspots in Region 8, Samar, etc. So I think what needs to be done, what we see from many other countries is that as we recognize that this disease is a new disease and we don't have treatment and we don't have a vaccine, we need to use so-called non-pharmaceutical interventions to minimize the health impact. And what we are advocating is that the DOH and the government invest in, as they invest in expanding testing capacity, to invest in actually contact tracing, identifying contacts and quarantining and isolating them so that we prevent further transmission of those cases. Now, unfortunately, this aspect of in response needs a little more strengthening. There is improvement in the last month, but it's not keeping pace with the pace of the testing capacity. And also the compliance with the requirements of the guidelines coming from the DOH doesn't seem to be universally good. So the DOH has come up with very good guidelines on how to manage positive cases, how to quarantine them, but the implementation at local government levels in different areas of the country is different. So where we see poor compliance with the guidelines, we're seeing the numbers of cases increasing, and this is actually becoming a worrying situation.
Good morning, Dr. Rabi. The World Health Organization said that the Philippines leads in rise of virus cases in the entire Western Pacific. How did the World Health Organization come up with this conclusion?
Kelly, I'm really thankful that you're asking me this question. The World Health Organization made comment or an assessment. The World Health Organization actually has a dashboard with the numbers of cases. What happened was a journalist at the inquiry used that dashboard and interpreted it in this way. It's not the World Health Organization that did this. I've seen a lot of comments and commentaries and points of view aired that the World Health Organization did this. The World Health Organization does not compare countries or make such assessments. All that assessment was done by a journalist attached to the inquiry in the Philippines using the data that we have in our dashboard, like many other dashboards that are globally available. So it is unfair to say that that WHO made that comment or assessment. We did not.
Dr. Rabi, we have a question from Joseph Morong of GMA7. Here's his question. Should Metro Manila, because there are emerging hotspots, should it return to MECQ?
We don't believe that the situation in the metro requires a reversal. We recognize the impact of this outbreak not only on health but also on the economy. And within the IATF recommendations, there is provision for localized lockdowns. And where we are seeing an upsurge of cases within the NCR in some localized cities or barangays, there is a need to make use of those provisions to suppress the transmission. And overall, what is most important is the feeling we get is that people coming out of lockdown seem to have forgotten that they need to still maintain physical distancing, hand hygiene, cough etiquette, everything that we've said. So as we go back, as we are striving to get our economy on track, it is critically important that we recognize that the threat of this disease has not gone away, and that we all have a responsibility beyond the responsibility that the government took in locking down, continue to follow those simple measures of good health so that we make it difficult for this virus to spread. Because what we are seeing now, worryingly, is that the increased levels of cases we are seeing is largely in a younger population of, say, 20 to 40 years. But eventually, this is going to spill over to our elderly and vulnerable groups. And when and if that happens, we may see an increase in the mortality rate. So to prevent that, it is the time now to act, that we have to all play our part. We have to all continue to follow the guidelines that we followed so carefully. We were in lockdown. Just because we have relaxed the provisions, it does not mean that the pandemic is over. We just need to continue to follow those procedures which we refer to as the new normal until we have a long-term solution for this pandemic.
Minimizing the transmission of infectious disease is a core function of public health, or the public health law. As a representative of the World Health Organization in the Philippines, how do you apply the isolate, test, and trace approach as the best way to control the COVID-19?
Martin, again, as I explained, this is what we have at this point of time because we don't have a specific treatment or a vaccine. So what we have at our disposal, which our regional director and the Director General has emphasized, is that by doing testing, isolating, and treating patients for them, and following these basic public health principles, many countries have achieved remarkable success in containing the spread of this virus. And we believe that the Philippines can also do so. They are on track to do it. We just need to accelerate that process of contact tracing and isolation and strengthen our compliance with the guidelines on physical distancing, hand hygiene, etc., so that we can stem the number of cases even as we expand the testing.
Dr. Rabi, question from Joseph Morong, if I may. What does the data show, though, in terms of what countries have the fastest number of increase in cases?
So, unfortunately, we see the fastest number of increase in countries that have not followed lockdowns and precautions that were advocated by WHO. So countries that ignored the warnings, countries like Brazil, to some extent the US, where they were late or hesitant in implementing those measures, we've seen massive increases in cases, overwhelming. Similar situation we saw a few months ago also in Italy. So this is why we continue to advocate for the non-pharmaceutical interventions that we know can help reduce the health impact and the economic impact of this disease.
Dr. Rabi, what is your message or reminder to the Filipinos?
We have to all work together. This is not something that can be controlled by government actions or by a combined action of all the departments and the IATF. This disease can only be controlled if every one of you, every Filipino, every person in this country takes responsibility to protect themselves, and through that action, protect your families, your parents, your grandparents, and your greater community. So we need to work together. We need to come together. I believe you call it your Bayanihan spirit. Maximize that and follow the guidance that your DOH and the government and WHO is providing so that we can minimize the impact of this disease.
Thank you very much, Dr. Rabi. Abeya Singh, the World Health Organization representative here in the Philippines.
Thank you, Martin. Thank you for having me.
Samantala, kumustahin natin ang kasalukuyang kalagayan ng mga Pilipino sa Oman. Makakapanayan po natin si Ambassador Narciso Cantaneda. Tama po ba? Cantaneda. Mula po sa Embassy of the Philippines in Muscat, Oman. Castaneda. Oh, nagkamali ng spelling ng writer namin dito. Sir, magandang araw po sa inyo.
Good morning. Magandang araw din sa inyo.
Ambassador Castañeda, sir, ayon po sa Oman Health Ministry, may higit 21,000 ng recoveries dyan po sa Oman. Gaano po kahigpit ang health protocols at ano po ang mga best practices na maaring tularan?
Sa ngayon, tama yung mga figures na binigay nyo. Medyo parami din ang kaso nila ng nag-increase ang number of cases of COVID nila dito. They're trying to restrict the spread by having certain protocols, pero medyo mahina. Katulad rin siguro sa ibang mga lugar na masyado nang nahigpitan sila ng ilang linggo, kaya ngayon na nagbukas para silang nakawala.
Opo, Ambassador, magandang araw po. Noong pong linggo ay nabalita ang 1,197 new cases sa Oman at 488 daw po rito mga non-Omanis at kahapon naman po ay 375 yung mga hindi taga-Oman ang nadagdag. Kumusta po ang ating mga kababayan naman dyan?
Sa aming mga records, 9 Filipinos ang naka-confine dahil sa COVID. Isa pa lang ang namatay. Unfortunately, medyo severe yung kanyang kaso. Pero yung sa mga 9 na hospital, 5 are supposedly out of ICU. The other 4 are a bit in better condition. So hindi naman tayo ganun yung community natin hindi naman ganun ang pinsala ng COVID saka. Yung mga ibang mga dayuhan, katulad ng merong mga laking populasyon dito ng mga nagtatrabaho, katulad ng Mumbai, at ibang mga workers nila, meron silang mga barracks. Diyan medyo mabilis kumalat yung COVID pag medyo dikit-dikit tapos hindi na susubaybayan ang nangyayari.
Opo. Ambassador, no July 1st po, yung Oman po launch ng new tax card system that will serve as a proof of registration ng isang taxpayer. Pero ano po yung posibleng epekto nito sa ating mga Filipino workers at migrants?
Maraming dito mga patakaran na nilalabas nila recently. Hindi pa rin nasisiguro kung ano eksakto ang epekto niyan sa ating mga kababayan dahil marami silang mga niro-roll out ng mga bagong patakaran tungkol sa expatriate workers dito sa Oman. Kaya titingnan ho natin kung ano ang mangyayari diyan pa sa kanilang mga programa na ito.
Ambassador, kumusta po ang repatriation efforts ng inyong tanggapan at ilan na po ba ang mga nakauwi?
We had our first successful repatriation flight last week. 279 Filipinos were overnight. Itong July 1st, we have to go home and escape the problems of COVID. Sa ngayon, we have about 6,700 Filipinos who have availed of the program, itong binibigay ng ating gobyerno, and our Philippine Labor Overseas Law Office here has been very prompt in trying to disperse all these funds available. Medyo katulad ng last time na kinausap nyo dito sa programa nyo, siyempre, meron tayong limited funds, what is available and what is possible to give. pero natutulungan ho sila.
Ambassador, pagdating naman po sa programa ng pinansyal, yung pong sinasabi nating Dole AKAP for OFWs, pero gaano na po ba talaga karami yung nakatanggap ng tulong? Base po sa inyong datos dyan.
According to the latest data that was given to me by the Polo office yesterday, 6,450 na ang nabigyan natin ng tulong ng $200 each. And this has been received by them. So that is the actual amount that has been disbursed. So 6,450 times $200, yun ang lumabas na from the Dole AKAP program. Now there is a remainder that still has to be disbursed, and it will be done quite soon, I'm sure.
Bilang panghuli, mensahe niyo po sa mga Pilipinong naninirahan sa OAN, Ambassador Castañeda.
Magpatuloy po tayo na magsundin ng mga patakaran dito tungkol sa COVID para hindi tayo maapektuhan ng gusto. Ang operations ng embassy are starting up. We are reopening gradually. Hindi namin talaga binubukas 100% dahil katulad ng alam na po ninyo sa Saudi at sa ibang lugar, nagkaroon tayo ng mga problema ng COVID na nasarado yung ating ibang mga opisina dahil sa infection that is unchecked. So we are trying to limit the progression of the disease as well, and we are trying to do our part. Pero kung merong kailangan talaga yung ating mga kababayan, meron tayong mga linya, mga hotline, meron tayong means of communication sa Facebook, sa other social media outlets, and they can get in touch with us. Meron the usual telephone, fax, etc. So it's a work in progress dahil talagang we are in a crisis situation. So it's a slow progression to returning to normal, and we will try our best to ensure that our fellow Filipinos are attended to adequately.
Maraming salamat po sa inyong panahon, Ambassador Castañeda. Nawa po ay mas naliwanagan ng ating mga kababayan. Mabuhay po kayo at mabuhay po ang inyong tanggapan.
Maraming salamat po. Thank you.
If we give the right information, let us consider that as part of our civic duty.
The fight against coronavirus is an arduous and protracted one, but this is a battle worth fighting and winning for.
The fight against COVID-19 starts at your doorstep.
Ngayon po ay makakapanayam natin si Governor Victor Yu ng Zamboanga del Sur. Maayong buntag kanimo, Governor Yu.
Buntag, Sec Martin, and of course, mayong buntag po kay Yusek Lucky. Labi na yun sa makikiyon sa programa niyo.
Yes, sir. It's good to talk to you once again, Governor Yu. Kumusta po ang inyong lalawigan in dealing with the COVID-19 situation?
So far, maayos naman, sir. After we have ECQ last March, 5 lang yung negative dito. And thanks God naman, naka-recover lahat. And maybe mga sa May, nag-GCQ kami, nakita namin na na-control namin kasi wala namang local transmission dito. Right now, we are wala namang local transmission dito. Right now, kasi so far, wala namang local transmission dito. Right now, we are receiving LSI na ROF dito sa probinsya. Although very alarming from outside the province yan, but we cannot do otherwise but to accept them since they are Sambusulian also. So far dito sir ngayon, yung mga check rapid test kit, tsaka nakarehistro din yung papasok to include from plane, from dito sa Mispil. So far, we have right now 13 positive na nasa swab. And unfortunately, naghintay ng mga 60 pa na positive sa rapid na hindi pa lumabas yung swab test. Kasi ipadala sa Zamboanga yung swab sample. And pasalamat ako sa ating administration, si President Duterte, binigay na bayanihan fund to buy equipment for our hospital and also build the laboratory that maybe by second week of July operational na, because right now we have 1 week gap or more para hintayin yung hintayin yung testing result from Zamboanga City. So gap na 1 week.
Governor, are you still there? Okay, so nang signal ni Governor, baka pwede natin.
Kahapon ng ating Presidente, Executive Order number 114, ito po ay yung sa Balik Probinsya Bagong Pag-asa Program as a pillar of balanced regional development.
Noong ika-20 ng Mayo, ang programa ay matagumpay na nakapagpauwi na ng mahigit 100 residente pabalik ng Leyte na inaasahang darami pa. At dahil nais agarang tugunan ang mga pangangailangan ng ating mga stranded na kababayan, ipinagpaliban muna ang rollout ng Balik Probinsya Bagong Pag-asa Program upang ihandog ng ating pamahalaan ang hatid tulong.
I decided as a matter of strategy na isuspend muna ang ating rollouts for the Balik Probinsya Bagong Pag-asa to give way. Unahin natin. Kasi this was a very clear instruction from the President. Unahin, pauwiin ang mga kababayan na stranded dito sa Maynila. Pagdating ng panahon na tapos na itong mga problema ng stranded, Balik Probinsya will now take the second already in the succeeding rollouts and simultaneous rollouts to all of the provinces of their choice.
Pilipino to kababayan natin. Tanggapin ninyo and provide for sequestration houses if you want. Yung doon sila i-quarantine. Pero hati-hati tayo sa problema. Total, hindi naman kami nagkulang. Whatever you need, we provide. Kawawa naman. Tulungan ninyo yung mga Pilipino.
Balikan po natin si Governor Victor Yu ng Zamboanga del Sur. Pasensya na po kayo, Go. Medyo naputol po yung ating linya ng komunikasyon. Ano-ano po ang mga safety measures na patuloy na ipinatutupad po ng inyong pamunuan, sir?
Yung rapid test namin, yung
na suliranin at ngayon nga po ay nag-a-adapt tayo sa new normal, gaano po kahalaga na mayroon tayong mga proyekto naman pang edukasyon, kagaya po ng naganap kahapon at yung for ed. Center po sa lalawigan. Okay, mukhang Secretary, mukhang nawala ulit sa linya ng ating komunikasyon si Governor.
putol-putol.
Opo, Governor. Nawala ulit sa linya sa atin ng linya ng ating komunikasyon kay Governor at tatry po natin balikan si Zamboanga del Sur Governor Victor Yu, Secretary, para alamin po rin natin yung kanilang mga ginagawang kahandaan. Governor, magandang araw po ulit. Governor, ulitin ko lang po yung tanong ko sa inyo kanina bago po tayo maputol. Ito po kasi marami rin nagtatanong sa atin tungkol dito sa Zamboanga del Sur. Sinasabi po nila na sa kabila nga daw po ng mga kinakaharap na suliranin, ngayon ay nag-a-adapt kasi tayo sa new normal. So sa inyo po, gaano po kahalaga na meron tayong mga proyekto naman pong pang-edukasyon, kagaya po nung nilaunch niyo po kahapon sa Provincial Library at Tech for Ed Center sa inyong lalawigan?
Actually, plano namin before na dito sa Zamboanga del Sur na talagang mag-cover sa signal sa Wi-Fi yung buong Zamboanga del Sur. And now, although there is a program from the ICT, we have also a program for the province in cooperation with the ICT. Maglagay kami ng infrastructure at equipment para ma-cover ng internet signal yung buong probinsya.
Na ang internet ay basic tool nga para sa edukasyon, lalo na ngayon na may pandemya, and you said it already, meron kayong proyekto na sinisiguro ninyo na itong internet ay mas lumakas pa para ma-cover po yung buong area ng Zamboanga del Sur. If I were to look at the map of Zamboanga del Sur, alin ba bahagi po ng Zamboanga del Sur ang halos wala hong internet?
So far, marami ng area dito, selected lang kasi sa na nasa map ng DICT na may internet. But yung gawin ng probinsya is maglagay ng mga antena and the facilities para to cover kung not maybe more than 80% namin ng signal.
Opo, Governor, kamakailan din po ay nakatanggap na honorarium yung ating health workers, pati na po yung mga barangay nutrition students sa inyong lalawigan. Ano na po yung update dito, Governor, at ilan po yung plano ninyong bibigyan?
So far, we have a list of 1,900 BSW and barangay nutrition scholar. Bibigyan namin ng honorarium. Alam naman namin na sila talaga yung frontline na natin sa barangay. In fact, I encourage them na huwag malitin yung responsibility niyo dahil maliit lang ang honorarium niyo. But your role, yung papel niyo sa barangay in terms of health monitoring is very important yan. Hindi kaya ng munisipyo yan, hindi kaya ng probinsya yan. Actually, 1,900 yung target natin. Many barangays, many BSW hindi accredited dito sa IPSO o sa DOS, kaya hindi sila nakatanggap. So we encourage the barangay officials, especially the health board sa munisipyo, na kailangan ipa-accredit sila para makatanggap din yung iba na hindi na accredited.
Governor Victor, sir, maiba ho tayo. Napaka-interesting po nitong hybrid yellow corn na under ng Plant Now, Pay Later program. Gaano na po karami sa ating dyan ang nakatanggap ng free corn seeds at ilan po ba ang ating target?
So far, yung target ng province is 1,000 beneficiaries or 1,000 hectares. So far, we have distributed, I think, around 200 plus pa. Kasi hindi naman pwedeng biglaan, especially right now, COVID tayo, hindi pwede yung maramihan yung pag-distribute. So, yun ang we focus also on the food production here in Zamboanga del Sur. Aside from the Plant Now, Pay Later corn seeds, din kagulayan dito para whatever, if mag-prolong tong mga COVID-19 case natin, situation natin, meron talagang makakain yung mga constituent or taga Zamboanga del Sur dito sa aming probinsya.
Governor Yu, bigyan po natin ng linaw po itong tungkol sa umuwing OFW naman. Base po sa datos ng inyong tanggal, ilan na pong OFW? Ano po ang kanilang kasalukuyang kondisyon at mga natanggap na tulong po mula sa inyong pamunuan?
So far, Sec, I cannot give you the exact figure, no? Kasi nasama dyan sa LSI kasi yung mga ROS natin. But we are awaiting for the balik program. Mag-create kami ng committee dito para mag-study doon sa mga ano bang livelihood na mag-match doon sa mga OFW natin na pumunta dito. But a few days ago, meron ding na-distribute yung OWA doon sa mga OFW na binigyan ng livelihood din. Parang puhunan nila yun na bigay sa kanila, which we joined them in the ceremony. Gawin talaga yung negosyo yun para mag-improve yung livelihood nila.
Ano po ang mensahe ninyo sa mga kababayan po ninyo dyan sa Zamboanga del Sur, Governor Victor Yu?
So far right now, especially sa kababayan namin dito sa Zamboanga del Sur, we always advise them to be cooperative, be alarm of the situation. Pagtulungan namin yung itong crisis na to. We don't allow it to happen like other cities na mag-spread out yung disease. Maganda naman yung outcome ng ano namin dito, Sec. And of course, we advise them to continue monitor, especially the LSI na dumarating sa barangay nila. And meron pala kaming ginawa dito, Sec. Any LSI or OF, nilagyan namin pa ng parang bracelet na indication that they are
wala ring business expansion. Maliban dito,